Live from Toledo, this is 13 ABC Action News.
Yay.
Not happy about that either, huh?
Straight ahead, we're talking about your health today on Ask the Expert. Podiatrist Corey Russell. He's here to take your questions. You can give him a call, 419-534-5430. We are talking about your foot and ankle health today on Ask the Expert. Dr. Corey Russell, he's here to take your questions. Give him a call, 419-534-5430. Your foot and ankle health is our topic today on Ask the Expert. Dr. Corey Russell joins us now with answers to your questions. Good morning.
Good morning.
Well, the first question is from someone who's been diagnosed with heel spurs. They want to know what the best treatment plan is.
Well, heel spurs is a common problem we see in the office. Heel spurs is kind of a layman's term for what we call plantar fasciitis, which is inflammation of the ligament that runs from the bottom of the heel up to the ball of the foot. Treatment consists of multiple different things: stretching exercises, ice massage, anti-inflammatory medication. Sometimes we'll take a cast of people's feet and actually make them a custom-made arch support, or an orthotic as it's known. Other times we'll give a corticosteroid injection into the heel, which helps to reduce inflammation and reduce pain. And depending how they respond to those kinds of treatments, sometimes we'll add physical therapy and some other modalities to treat that problem.
So sometimes it can take quite a long time for
It can. Some people respond quickly, others it takes quite a while. So usually most people fall somewhere within that time range, and there's a small percentage of people that don't actually get better with conservative treatment, require surgery for that problem.
Okay. Oh, another viewer wrote in saying that their big toe has been pretty stiff and painful for quite some time, and it hasn't improved. So what should they do?
Well, the first thing I would do if I saw this patient in the office would get x-rays on that foot. Obviously, take a look at the joint, see if there's arthritis in there, see if there's other problems. Obviously, a clinical exam would be part of that overall assessment. Depending on what the x-rays show, frequently this kind of problem is related to arthritis in that joint. Now, the arthritis can be treated, once again, a few different ways. A steroid injection into that joint reduces the inflammation and pain like you would for any arthritic joint. Sometimes orthotics or those custom-made arch supports are utilized. Other times anti-inflammatory medications are used, and that seems to help. If none of those things work, then you're looking at more of a surgical option, or we'll go in there and remove some of the spurring and some of the other arthritic changes in that joint to make it more comfortable so there's better motion and obviously less pain. If that doesn't work long term, they may need a fusion of that joint or a joint replacement in the big toe joint like they do in knees or hips.
Okay, and speaking of toes, typically when you break your toe, it's kind of a waited out type situation, right?
Yeah, there's not a lot of treatment for it. Obviously, the first thing we do in the office is get x-rays on that toe to see how bad the toe looks. If it's a bad break, sometimes we have to surgically address that. If it's your standard break and it's not really displaced or anything, we'll typically put them in a surgical shoe and have buddy splint the toe to the toe next to it.
Gotcha. And speaking of, as we talk about feet and ankles here, another viewer wrote in saying that they broke their ankle a few years ago, but it's still hurting them occasionally. They want to know why and what can be done to treat it.
Yeah, a lot of times when you break anything into a joint, that can lead to premature arthritis, kind of like we were talking about with the big toe joint, but this is as a result of the trauma from the ankle break. Similar treatments are done: steroid injections, anti-inflammatory medications, sometimes physical therapy can help. If none of those things work, you can actually do an ankle arthroscopy, once again like they do on the knee, to clear out some of the arthritic changes. If it gets really severe and all those things fail, then you're looking at a possible joint replacement or a fusion of that ankle joint.
Okay, doctor, we have time for one more question here. What's the single best piece of advice that you can give to people to avoid any sort of problems with your ankles and your feet?
That's easy. The simplest thing is good, supportive, proper fitting shoe wear. That helps a lot of problems.
All right, well, there you go. Good shoes. Dr. Corey Russell, thanks so much for coming in. And just a reminder for you, we do have our expert segment coming up every single week on our Sunday morning show.